Um, Welcome back. Thank you. We are still looking at non-communicable diseases. Amongst the non-communicable diseases, the commonest ones being the ones that we have been talking about. Like last time, we're talking about hypertension, we'll talk about asthma today, obesity, uh, mental disorders, amongst a lot more other conditions. But we'll just talk about the common ones, which are those. So today we are talking about asthma, which is a non-communicable disease. Okay, this is a non-communicable disease that affects the respiratory system. So it is classified under the obstructive lung disorders because it causes or it is caused by narrowing of the airways due to bronchospasms that result in constriction of the bronchial muscles in the of the bronchomuscular walls, okay, in the lining of the respiratory system, which leads to decreased airflow and difficulty with breathing. It is also known as a reactive airway disease, which is inconvenient most of the time, but it is manageable. Therefore, asthma is caused by inflammation and constriction of the bronchioles due to hyperactivity of their smooth muscle, thereby leading to a series of spasmodic attacks of wheezing and shortness of breath. Various factors contribute to the cause of asthma, which include the exposure of cigarette smoke, climate change, which is a common theme currently, physical exertion, or emotional stress. It normally begins during childhood, and the disease is commonly triggered by viral infection. There are quite a number of factors or of symptoms that can be pointed to as asthma, but the diagnosis of asthma usually is confirmed by presenting a response to an inhaled bronchodilator, meaning what happens is that the doctor or the clinician who actually suspect asthma in a patient, then this clinician is going to prescribe some medication for this patient for a specified period of time and will monitor the response. If the response becomes positive to those drugs, asthmatic drugs which were prescribed, then the diagnosis could be confirmed as asthma, in that there are quite a number of conditions that present in a similar way. In childhood, the first symptoms may appear before the age of 5 years. However, diagnosing asthma in young children under 5 years is difficult due to the fact that other childhood conditions may have similar symptoms. Okay, so after after all symptoms pointing to the diagnosis of asthma, then the clinician will narrow it down to want to see exactly to what does this symptom respond to. Then the doctor will actually prescribe these medications for at least 4 to 6 weeks and see if the child is going to respond positively to these medications. If the child responds positively, then it will be clear that the child has asthma and the treatment for asthma will commence full time. According to the global burden of disease, the most recent revised global estimate of asthma suggests that as many as 334 million people worldwide have been diagnosed with this condition. The majority of people affected are in low and middle income countries, and its prevalence is estimated to be increasing fastest in those countries. Its etiology is still unknown. Therefore, this is due to asthma not being defined as a single disease, but a variety of multiple diseases with similar clinical features resulting from different genetic and environmental causes. Mainly developing at an early age, the complex interplay between hereditary and environmental factors which are occurring at this childhood level uh, occur actually at a very critical time of development, which may lead to the onset of asthma. Therefore, there is supposed to be the clinician ought to be very careful in trying to see to it that they get the correct diagnosis and they are treating the correct condition, which is asthma. Usually patients that are atopic are so susceptible to develop this condition. An allergic reaction to antigens that normally do not cause a response predisposes to asthma onset, demonstrating the genetic component of this disease. Asthmatics can commonly suffer from other allergies, including food, skin, and drug allergies. Also implicated in this web of the causation of asthma is it's due to the increased prevalence of asthma in the developed countries and urbanized areas, supporting the theory that environmental factors or environmental exposure are contributing to the incidences of asthma. Sufferers are chronologically or are chronically exposed to substances when inhaled, which leads to an allergic response in the airways. Okay. Therefore, the following risk factor increase the possibility of disease development, and some of these are hereditary factors, environmental factors, okay, like occupational factors, lifestyle factors such as tobacco smoking, and among other conditions. Pet hairs, pollens, and other causes which may include premature birth, in that the child's lung system is not yet fully developed to defend itself against certain infections. Therefore, asthma can easily develop in such kind of children. Low birth weight, early age antibiotic use, as well as diet. It's very important. It can also cause this. These are just some of the triggers which may trigger the asthma attack. Amongst them, we have exertion, which is exercises. Okay, if the exercises, you do exercises beyond what is supposed to be done by someone, you end up having a dry throat, which will trigger a spasmodic contraction and have an asthmatic presentation. Pollen, inhalation of pollen, insects in homes, chemical fumes, cold air inhalation, as well as smoke and pollution. Stress is also one of those that can lead to such kind of responses, as well as pets. The pathophysiology. In asthma, airway constriction is caused by a combination of bronchial constriction and bronchial inflammation. This leads to chronic lung pathology in which the bronchial airways are prone to narrowing, causing episodes of wheezing, chest tightness, coughing, as well as breathlessness that range in severity from mild to potentially life-threatening. Entrance of allergen through the oronasal cavity results in swelling of an already compromised and highly sensitive airway. As a result, constriction of smooth muscle in the walls of the airways result, and excessive release of mucus into the areas, causing airway narrowing and ultimately reducing the amount of air circulating in and out of the lungs. In other words, it reduces actually the ventilation perfusion ratio, as the gaseous exchange, the surface area for gaseous exchange will be reduced, because the amount of air that will be going in, the dead space of the lung will be increased, will increase, meaning the space of the lung tissue that is not participating in gaseous exchange will increase, because there isn't enough air that is freely flowing in and out of the lung. Due to these differences in air flow rate, the lung become hyperinflated, in that breathing in is passive, but breathing out, because if we follow what is in this picture here, this is how the normal is supposed to look like. The normal airway is supposed to look like. The one which has asthma would look like this, because of continued bouts of asthma attacks. That is how it is going to look like. During an attack, it will even constrict further due to spasmodic contractions, as we can see. There are some kind of tightened smooth muscles around this tightness in smooth muscles are closing up the airway, resulting in inflammation. Once inflammation is caused, the cells around the epithelium of the airway, which are the goblet cells, will respond by also increasing the production of mucus. Once that happens, it is going to increase or decrease further the lumen of the airway, resulting in trapping air in the distal end. Because breathing in is usually is active, breathing out is dependent on elastic recoil from the distal ends of the respiratory system. So there is nothing that is pushing air from the distal end to here apart from its elasticity. So due to the tight closure of the airway, air will not manage to passively come out, and the air will end up being stored in the distal end, which will result in hyperinflation. At the end of the day, this will bring about the alveolar hypoventilation and the ventilation perfusion mismatch, which will now lead a person to be hypoxic and bring about issues of hypercapnia and a lot of retention of carbon dioxide because there is loss of gaseous exchange in the distal end. Even if gaseous exchange has happened on the distal end, the air that has already exchanged is unable to come out so that it exchanges with carbon dioxide and oxygen that is supposed to be going in. This will result into serious conditions which can even go up to, which can even result in conditions such as respiratory alkalosis. Okay. So this is just a quick summary on what has been discussed in that during on the pathophysiology. During an asthma attack, there will be narrowing of the airways, there will be bronchospasms, the heart rate will increase, then there will be an increase in oxygen during inspiration, and hyperventilation will occur in the patient. However, weight of breathing will be increased due to narrowed bronchi, which makes it more difficult to breathe because at this point, a person will be trained by all means to push the air through this narrowed airway and thereby increasing the work of breathing. So this is what happens during an attack. Okay. So it may also result in increased heart rate, bronchospasms, work of breathing will result as some of the presentation that we are going to see, a wheezing sound, and all this will be the presentation of what will happen during an attack. So asthma is not a one size fits all, as we have said that it's actually a broad name that means a number of, that would actually mean a number of conditions that are presenting in a similar way, but that which presents as asthma will actually have some bronchoconstriction on it, which will respond to some of the inhalers when applied. Types of asthma. There is what is referred to as allergic asthma, which we said it is due to atopy. The type of asthma that is triggered by allergy, substance that is responsible for cause of allergic reaction are more specifically in sensitive people. Okay, so there are those that are allergic, and when they breathe certain substances which they are allergic to, it is going to cause inflammation, and cause this asthmatic response, which is part of the common type of asthma that we usually see around. Usually develops intrinsic asthma, on the other hand, usually develops after the age of 30 years, where allergies do not play any role. It is likely triggered by respiratory irritation, such as cleaning agents, perfumes, strong perfumes, that is, smoking, and other irritants that would cause irritation in the air. This is what would be, that is what is known as intrinsic asthma. So including the asthma that would develop because of occupation exposures, people working in industries where they are making these drugs, where they are making where there is actually a lot of pollution and it is they're exposed to these pollutants. Their airway will be injured and they are likely to develop what is referred to as intrinsic asthma. Exercise-induced asthma, it affects anyone and at any age. It is caused by a lack of heat and moisture in the lungs, which occurs during strenuous exercise. Therefore, it is very important that when everyone, even you and me, when we're exercising, we have to at least exercise within our normal limits. Once you want to do it more than what the body, what the system has been trained to handle, you end up actually getting finishing up all the moisture and predisposing your system to developing this type of asthma. There's also what is known as nocturnal asthma, which usually happens with people when they are asleep. Victims tend to sleep earlier and they wake up at the middle of the night due to difficulties in breathing, and they will drink a glass of water to try and relieve the symptoms. So this, when the victims wake up, just find that they have some kind of uh, asthmatic presentation. Okay, and they wake up due to that. It is referred to as nocturnal asthma. Occupational asthma occurs as a result of inhaling chemical fumes or dust in a working environment, steroid resistance, overuse of asthma medication, which leads to status asthmaticus, which is a severe asthma that does not respond to any medicine. So at that point, that is the worst. Okay, that is the worst in which you have tried to take this and that medication, nothing is working, and the condition just keeps on worsening. Okay, you may also experience wheeze, dry cough, chest tightness, fatigue, as well as dyspnea when a person has asthma. These symptoms occur due to pathophysiology of the disease. Bronchoconstriction causes an audible wheeze and subsequent cough. So we have already explained the pathophysiology, and the symptoms will occur because of those pathophysiological features that we have discussed. It becomes worse when a person has difficulty to catch breath and difficulty talking as well as concentrating, difficulty talking and walking, developing cyanosis. When these signs and symptoms present, a person should be aware and advised to consult your general medical practitioner as soon as possible. Usually people that are asthmatic, they usually recognize these triggers and those feelings. So it is prudent to realize and catch them first before anything comes up and seek medical intervention, or actually intervene in a prescribed way that somebody has already been trained into. Risk factors and prevention include there are few risk factors associated with asthma that can lead to the onset of asthma, an attack, or other respiratory symptoms. Number one, the closeness of home or work to airports, industries, shopping centers. So these are risk factors in that these are pollutants. Usually you have urbanization in these arrangements, you have environmental irritants, which these industries, the airport will be releasing into the environment. So if you are living near, you find that you'll be exposing your airway more often to these irritants. At the end of the day, you can develop asthma. Okay, insufficient education and information is very important, as people may be living in such kind of places and they will be inhaling, doing all of these kind of risky activities without knowledge. So insufficient education and information is very important and it is a risk factor. The use of spray insecticide or insect oils may continue irritating the airway and end up causing asthma. Prevention of an attack or an episode is better in the case of asthma because it cannot be cured. Number one, education on the disease and medication is very important so that the person understands why they have to go undergo or whatever you are telling them to do. Once they understand, it will be easier for them to follow through. Follow the doctor's instructions on how to take medications, on how to use medications and how to keep symptoms under control. identify the aggravating factors such as smoke, dust, environmental risks, and all those other risks that we have talked about. Keep record of recurrent symptoms and try to maintain control. Go to the doctor for regular checkups. So these are some of the things that are supposed to be done for as prevention. Medical wise, once the diagnosis is made, you will be prescribed with what is known as an aerosol or an inhaler, which are going to have at least two types. One of the two types of drugs, which are short-acting beta-2 agonists, which are quick-acting or rescue medicine, or long-acting beta-2 agonists. These are not used for quick relief. So at this point, what is important is that whenever there's an attack, this person can just pull out an inhaler and push it in the airway and resolves the inflammation and opens up the air. Environmental health officers and public health officers have a role to play in the control of asthma. As public health officers and environmental health officers play essential roles in controlling asthma by addressing both environmental factors and broader public health issues that contribute to the condition. Their collaborative efforts are critical in reducing asthma prevalence and improving health outcomes for affected individuals. Let's look at the role of each one of them. The role of public health officers. Number one, to educate and to spread the awareness message. Okay, it is important that public health officers take up this role, educate the communities about asthma management, including recognizing the triggers that implement that would trigger the asthma attack, or those people in the community should be aware of the dangers that can predispose them to developing this kind of condition. They develop, number two, community programs. Public health officers should come up with community programs which they develop to support the community-based asthma control programs, focusing on vulnerable populations